Stephen, Thierry, and Taehoon, thank you so much for joining us. Over to you, Stephen.
Good morning, everybody. Thank you so much, Kim, for the introduction. And we're delighted to be here today with the World Affairs Council on another important conversation. Again, my name is Stephen Cheung. I'm the president of the World Trade Center Los Angeles. And today we're joined by two guests that can help us shed some light in terms of what's happening around the world. As we're looking at the impact of COVID-19 on the US and also with the Los Angeles region, we've been seeing that we're taking a lot of great lessons from our international partners. And Canada and Korea has long been our longtime partner and also allies when it comes to trade and commerce as well as investments. But in a time like this, we're also learning quite a lot in terms of the health epidemic and what we can learn from each other. There are currently over 44,000 Canadians are living in the Los Angeles region, and there are over 230,000 South Koreans and Korean Americans that are living in Los Angeles County. And their trade impact obviously is very important. Anything that's happening around the world is actually impacting this region significantly. And so today we are thrilled to be able to get some great information and feedback in terms of what's happening in Canada and what's happening in South Korea and what lessons we can learn from each other and how do we move on from here. With that said, I would like to open the conversation by having each of the speakers quickly give us a quick overview in terms of what's happening in respect to their own country. So we'll start with Trade Commissioner Weissenburger. Thierry, please.
Hi, thank you, Stephen. Thank you for giving me and more importantly Canada the opportunity to share the status of our health crisis, of the global health crisis, and what it means for Canada, and also a little bit of the measures we have been taking, both on the health side, but also very importantly on the economic side. So I won't dive into much detail at this point. We'll get into that later, but as of this morning, Canada has tested almost 360,000 people, out of which 18,500 were a confirmed positive case of COVID-19. And unfortunately, we had as of this morning, 401 deaths. The spread of the virus, as in the US, is uneven. The most populous provinces are more affected, obviously. Quebec, who now garner almost half of the cases, Ontario, Alberta, and BC. So that's where we are in terms of the overall demographic, where the disease is prevalent. The number of illnesses in Canada have not peaked yet, so we're looking eagerly to meet that and we'll know after it probably that we have picked. But we see that already that isolation measure, aggressive measure, and strict enforcement as well seems to pay off. In particularly in BC, who was first affected with the virus, where we see now cases decreasing significantly. So maybe in BC the peak has been reached. We're not quite sure. In terms of economic support, again, I won't go too much in detail at this point. We'll get through the questions, but we have taken, like almost every country around the planet, aggressive, wide-ranging measure. First, directly to help Canadians to pay their rent, pay groceries, and also to help business continuing paying their employees in this time of uncertainty. That's a very, very important element for us, keeping business afloat. There's been also a series of progressive action. Overall, that represents something around $500 billion in credit and liquidity support for people. By some estimate, we are talking, if you include provinces and federal action, it's close to, or if not above, 8% of the GDP. So one of the most serious effort with the US and I think Australia as well around the world. So 8.4 according to a study I read recently, and more to come, obviously.
Thank you so much for that. And with right now, I think a lot of the entire world is looking very carefully at some of the other countries that have done a very good job in terms of containing what's the COVID-19 virus. And South Korea has been hailed as one of the leaders in that effort. Taehoon, can you give us quick updates in terms of what's happening in South Korea and what we can learn from your country?
Okay, thank you, Stephen. Yeah, I'd like to share with you and our audience about what is going on in South Korea regarding the COVID-19. As of April 8th, the cumulative confirmed cases in Korea is 10,384 with a death toll of 200. The number of new cases per day has been fluctuating around 50 for past 3 days. And now I would like to explain briefly about some of the principles behind Korea's response to the COVID-19 outbreak. The Korean government's COVID-19 control strategy consists of the 3 T's. That is the testing robustly to identify confirmed cases early, and tracing their contacts to prevent further spread, and treating those infected at the earliest possible stage. As COVID-19 infection can manifest with little or no symptoms, we prioritize every early detection through preemptive diagnostic screening and rigorously epidemiological the investigation, followed by intensive treatment at the earliest possible stage to increase the likelihood of the successful recovery. So the testing, the robust diagnostic testing capability lies at the core of our control strategy for COVID-19 epidemic, because it is the basis of quarantine and treatment. We set up 635 separate and isolated screening centers, which is to protect healthcare institutions from contamination and to prevent cross-infection between potential patients. On top of the driving through testing stations, we also introduced phone booth type open air walkthrough testing stations at Incheon International Airport for inbound passengers. Tracing. The government is vigorously tracking down and testing those who had been in contact with the confirmed cases, utilizing credit card history, CCTV footage, and mobile phone GPS data when necessary. The contacts identified through these tracking are tested for COVID-19, put under self-quarantine and monitored on a one-on-one basis using self-quarantine safety protection app. And the extensive screening goes so far as to conduct post-mortem diagnostic tests on deaths with unknown causes. Third is treating. To secure hospital bed necessary for treatment, we classify the patients into 4 categories, and we prioritize medical resources to those who are in need of treatment. Patients with mild symptoms and need little medical care are being accommodated under quarantine in facilities called living treatment centers. They get monitored by healthcare staffs at least twice a day for symptoms. But I also would like to mention that the high level of public trust and civic awareness and adherence to personal hygiene, voluntary testing, self-quarantine, and social distancing have effectively slowed the spread of COVID-19. Thank you, Steve.
Thank you, Taehoon. I think both of you touched on this a little bit, and as we in the United States right now, especially in Los Angeles, we're looking at our potential peak in the next 7 days or so. And so at the same time, I think what we're seeing is the beginning of the economic impact on our local region. And we've already seen these numbers rise very quickly throughout the United States. For example, over the last 2 weeks, there's been over 10 million residents applying for unemployment insurance. So we saw that the immediate impact of the virus has been already devastating to not only our economy, but the world economy as well. When it comes to that particular focus area of the economy, what policies do you envision being the most successful in reducing the severity and also the length of this potential global recession that we're anticipating? Maybe Terry first.
Yeah, well, I can. There's a number of things to say, but as I alluded to in the introduction, of course, the immediate for Canada, at least, the immediate rescue package has been to provide financial support to those who lost revenue, jobs, the individuals, and so on. And that's really a key focus in Canada. But the key focus is also very much to minimize the loss of jobs. So, in the first instance, we reacted massively with support to individuals, but now we are shifting gears more towards businesses, and in a very massive way. So as early as last week, we announced a 75 wage subsidy program for business who lost 30% of their revenue. That's a key measure. That's a massive amount of money that we spend on that. It's much easier it's much harder, to recreate jobs when they're lost than to maintain them, at least if it's not lasting too long. Of course, time will tell how long this situation will last. But and the government of Canada, like many governments, have come through that crisis in stage, in waves of measure, reacting to the severity as we were taking conscious of the severity of that crisis. And I started with the individuals, as I said, caring for people. By the way, Canada has a universal healthcare system, which helps to some degree mitigate the pain and also help the reactivity of the health system. But then very quickly turning to business, also the things, keeping cash flow for the business, a wage subsidy program, credit, interest-free loans, facilities, guarantees to banks so that they can extend credit to business in difficulty. And of course, all sorts of measures, also monetary and financial, to ensure stability of our banking system throughout that moment. The other point, which is perhaps a little bit more targeted, but also looking at certain industries that suffer, maybe either suffer more or are very critical to the overall infrastructure. I'm talking about things such as airport or food supply, or even broadcasting. So we have specific initiatives, specific funding targeted towards those industries.
Great, thank you. Taehoon?
Well, I think I'd like to add that in the spirit of the solidarity, the nations should work together to share best practices and coordinate the public health and financial measures, preserve the financial stability, develop cures and vaccines while minimizing disruption in the trade and global supply chains. We need to adopt the expansionary macroeconomic policies, strengthening the global financial safety net, and working together for the economic stability of the least developed nations. And we also need to find a way to allow cross-border travel for essential purposes, especially for the scientists and medicals and professionals and the business leaders. And
yeah.
Do you want me to go on for the with
Go ahead.
Also the COVID-19 outbreak is simultaneously impacting the supply and demand and causing the multi-crisis for the real economy. So the relief packages include, we have both monetary and fiscal policies, and are aiming for the stimulus both supply and demand aspects, which would curb up the contracting impacts of the situation, so that the economy can soft land as much as possible.
Yeah, if I may add a couple of important points. I think one positive element, we'll try to find as much positive as possible in this moment. But one positive is that I think we learned a lot from the previous crisis, in particular the most recent one in 2008. And the governments have reacted very quickly, very swiftly, and massively. If you take Canada, if you compare the type of effort we are proposing and the measures we take right now, it's more than 3 times what was done in 2008. So the severity is well understood. The other important element that was just referenced is vital to many countries, and certainly to Canada, is to keep the trade, the international trade, and the supply chain alive and kicking. It's obviously critical for medical supplies, critical to deal with the sanitary and healthcare crisis, but it's also critical in an integrated world. It's critical to rebound quickly and to keep the economy afloat. Not any single country can produce everything, and there will be tendency, there will be temptation to go towards seclusive and protectionist approach, and that's normal, that's natural, well understood. But at the same time, we should resist to these trends and keep not disrupting the supply chain, not disrupting international trade, coming together as a global community in concert to coordinate reaction, economic reaction, and health reaction to that crisis. I think on the health side, it's natural. The scientists have been accustomed to work together and share best practice. I think we're getting very quickly to treatment and vaccine because it's a global effort. It's a bit more difficult on the economic side, naturally. So Canada will be a strong promoter of keeping borders open and supply chain completely fluid.
So as a follow-up question, last week we actually spoke with Dr. Chi from Air China, who talked a little bit about the flexibility when it comes to U.S. government working with other nations in terms of releasing visa waivers and stuff like that, so that our medical professionals can travel back and forth really quickly to learn from each other. When it comes to trade, there's also a bit more issues. So let's address the elephant in the room, which is, I think, just a couple of days ago, specifically to Canada, the White House has issued a statement specifically asking our producer of masks not to export these products to Canada. I wanted to get your take on it in terms of, to your point, and at this point, we see the importance of the global supply chain being more closely tied together. And also last week, as we're talking about it, a lot of the medical supplies that were manufactured in not only China, but Asia, are now starting to come back to the United States because they've gone through their wave of the intensive need for those products. So now they have excess capacity. We see the importance of this global tie, and how do you see it from your perspective, specifically in relations to what the White House has issued last week or a couple of days ago? Thierry first, and then we'd love to hear Taehoon's response to that as well.
Yeah, that's a bit of a leading question, but I'll try to address it in as objective as possible way. I would start by saying that Canada and the US share the largest, deepest, and most sophisticated trade relationship by a long stretch. Largest border as well, longest border, unprotected border. That needs to be noted. So there's a lot of exchange going on, not just in terms of goods, but in terms of people, in terms of ideas, in terms of money. And it's essential to keep the flow of all these things going. We understand in that moment that non-essential travel by individuals needs to be restricted. That's a sanitary measure that the agreement we had in concert, in collaboration, a mutual agreement that non-essential travel be restricted across the border between Canada and the US. That was on March 18, and that was done really jointly. But essential travel, travel that will support the economic activity, essentially, that will support the resolution of that health crisis. I give you an example. I think it was in the news over the past couple of days. Hundreds of healthcare workers in Windsor go and work to Detroit, cross the border every day to work. So it's not just about trade, it's about people helping each other and contributing to solving that problem. Detroit is much more affected than Windsor, at least right now. So there's a big contribution being done there. I'm sure the other way will happen in a similar circumstances. But given the deep integration of our economies, going alone and creating supply disruption is really counterproductive. An example which is related to the case you were alluding to, Stephen, which I think was the 3M situation, you should know that Canada actually supply a very unique medical pulp to 3M to produce those N95. So the production of that item actually component cross the border several times before a finished product is done. Sometimes the finished product is by 3M, is done in Canada. So it's not that simple, and that's probably why there's been a change of on that particular case. This is true, though, that there is certainly immediate pressure because of the current situation to have a first right for refusal in terms of certain exports of critical supply. We are in intense conversation with the White House, with the U.S. government. Our Minister of Foreign Affairs met Secretary of State Pompeo on Monday, and we got assurance that, of course, as strong allies, it will be a case-by-case basis. But in general, there's no. We got reassured that a common sense will prevail to a large degree. There'll be guidelines, I think, that will be issued today, tomorrow. I'm not quite sure. That will spell out a little bit more in which cases a product may or may not be looked by FEMA and CBP before being actually exported. But we are confident this will be resolved in most cases.
That's great, Thierry. Taehoon, to change that question just a tiny bit, Thierry touched on this a little bit. How are you seeing in your country how the public and private sectors are coming together, or are they not, in this time of need? Are they cooperating, and are they cooperating so that they can line themselves up to address the crisis? And sometimes the private sector and also the public sector don't always align. How are you seeing it work out in your country?
Well, actually, the private sectors and public sectors, we're on this together. I want to highlight that the government and the private sectors share the common grounds. It's people. So that we all know that the prosperity of the economy depends on the productivity of the labor forces and capability of consumers. So we're on the same boat. And the pandemic situation like COVID-19 negatively impacts our production and consumption and disrupts the functions of both public and private sectors alike. In this kind of situation, the private sectors may have resources to supplement the inadequacy of the public sector. So with the coordinating efforts of the government, we can come up with some positive results. So let me give you some example in Korea that in Korea, when the confirmed cases of the COVID-19 increased rapidly so that we needed more facilities to accommodate patients, many private companies provided their company training facilities, and those facilities are now being used as the living treatment centers, and it eased the bed shortage of the healthcare institutions and helped to hold our medical system intact. So I think well, I don't think it's not a good idea to separate the public and private sectors, but we have to look at it as a whole system. That when the private sector is flourishing, then that means the government can do more services to people, and that increase the productivity and the consumption. That will make the virtuous cycle for the entire economy to flourish. Thank you.
Well, I still have about a dozen questions I want to ask you guys, but I don't want to take up all the time. I know that we have a lot of participants and audience members that are asking questions. So I'm going to, at this point, hand it back to Jessica from the World Affairs Council to help us moderate some of those questions. Jessica?
Great, thank you so much. So I think, Taehoon, this first question would be for you, which is, what is the different response between Seoul versus the countryside, or is it being handled differently between the major metropolitan areas and the countryside?
Well, could you say that again? I wasn't.
Sure, that's fine. So are your actions the same in Seoul and the countryside, or how are they different?
Well, actually the major outbreak in Korea was centered in in the southeastern part of the Korea. But our government had the approach of the holistic government approach, that we had a headquarter at the central government, but with the coordination with the local government, and we had to communicate each other very well and coordinate it, so that the response between the countryside and the center of the city is not that different. Just that it depends on the density of the outbreaks and the resources they have. But we have the resource management system that the central government allocates or reallocates the resources to the more not as well endowed sides of the country, so that we can transfer the patients, we can transfer the resources, so that it will have the almost similar the treatment for the each part of our country.
Great, thank you. Thierry, this one's for you. Could you give more details on the nature of the support to individuals? Is it expanded unemployment benefits? What is the form of the wage subsidy program to businesses?
Okay, so we're getting a little bit in technicalities, but the so-called, for the individual to start with, the so-called Canada Emergency Response Benefit, which was one of the first measures announced by the government, is a taxable benefit of $2,000 a month for up to 4 months for now to eligible workers. So basically, workers that have lost their incomes due to COVID-19. Initially, and that's a current refinement of that benefit, initially that was typically addressed through with the same criteria as unemployment insurance would work in Canada. But of course, there's also a lot of independent workers and different situations and students and so on. So the government is currently revising as part of the second package that will actually also include the wage subsidy, which is directed to company, is bonifying that Canada Emergency Response Benefit. On the support to business, which is multiple, but the question is specifically around the Canada Emergency Wage Subsidy. As I said, it covers 75% of salaries for qualifying business for up to 3 months. And to qualify as a business, you have to have lost 30% of your revenue from the previous year. I will just give a little, I'm diving a little bit deeper, but more relevant to maybe some of the listeners. Some of our people online may be a California-based company with a subsidiary in Canada. These benefits are completely available to foreign subsidiary and branches, as it would be for any Canadian business. So that's point number one. And then for certain type of business that conduct, for example, R&D, or are just invested into Canada, so they don't have that track record, we are looking at that issue to also help them in a similar fashion. But obviously, they cannot meet all the criteria because of their particular conditions. Hopefully, it answers the specific question here.
Great, thank you. Taehoon, this one is for you. How many tests have been administered in Korea? And please discuss when planning began for the crisis and at what level the government and industry heads were involved at that early stage.
Oh, well, currently we have about 20,000 tests can be conducted per day. It was 3,000 in the beginning, but we gradually augmented our capability. And at this point, we have tested about 470 or plus 1,000 tests for the coronavirus. And I think it was possible because we were when the coronavirus outbroke in China, that our companies was act fast to try to provide develop the test kits, and the government was fast enough to approve that the use of the kits, and so it was distributed to around the country fast enough. And we had also the preliminary screening stations. We had about 635 that was separated from our medical institutions so that we could have versatility. But at the same time we can eliminate the contamination.
Great. And just as a follow-up to that, can you expand on the contact tracing in Korea? Does it begin with interview of the affected person and then move to credit card history and the CCTV and other tools? And then how is that affecting the economy?
Well, we were using many the resources or the data, but it's the anonymized information that it was open to public, and using that and the provided information to public so that they know that whether they have been cross path with the confirmed cases and where to be careful. But at the same time, that gives the people the kind of understanding that they don't have to fear too much, so that they can have their social distancing, wearing masks, and then with that kind of protection, they could go on with their daily lives. Of course, it's not as much as the normal times, but it will certainly not shut down the entire system, so that the life can go on and business can go on without too much disruption.
Thank you. Thierry, this one is for you. Many American college students study abroad in Canada. How are those individuals being supported as they return home to Los Angeles?
Okay, that's a good question. The U.S. citizens who are students who are studying in Canada can obviously decide to stay in Canada. If they decide to come back, they'll be handled by U.S. Californian authorities. I'm not quite sure exactly what is expected here. We don't provide any particular consular support to U.S. students, as we would, for example, to our own citizens who wish to go back or are in a bind to come back, especially when it's a difficult situation. Not so much in the U.S. because it's pretty simple. Although there has been cases for us with cruise ships in particular, and we are grateful for the U.S. government assistance in repatriation of Canadian citizens who were on those cruise ships, especially those recently who had docked in Florida. But in terms of U.S. students, this is a large population for us, a large part of our student population. Canadian universities are great, good quality, and affordable. So that's, in that sense, that's a good question. But of course, there is Air Canada flights, still regular flights going back and forth to major cities, 4 major cities in Canada to LA in particular. So if they want to come, if they need to come back, they can do it seamlessly.
Thank you so much. Taehoon, this one is for you. Do you have any updates about what's transpiring in North Korea regarding their response and how they're coping with coronavirus?
Oh, it's a very difficult question. We have very limited information confirmed, so that it's very difficult to answer that question. I mean, it's North Korea. They're not disclosing their information about the COVID-19. So gee, yeah. Well, yeah.
Fair enough. Okay, perfect.
Well, maybe just sorry, I'm jumping back to the original question, but the question may be in the context, as in the US, of all universities basically and schools have shut down, and completion of the year is done online, and hence there's no need for US students necessarily to stay in Canada at this moment and complete their year or graduation in some cases. That's actually a personal experience that I have. My son being with us here in Los Angeles and completing his school year at Ryerson in Toronto remotely. So that's very much a possibility.
Great. Taehoon, this one is for you as well. What are the specific preemptive diagnostic screening measures that South Korea is undertaking at early disease stage? Are they also finding that 25% of carriers are asymptomatic?
Well, we are when we have the known carriers and the patients, and when we through the epidemiological investigation, we could track down the possible contacts, and we have them all tested, and they have them quarantined. And with the one-on-one consultations, we could watch and monitoring their symptoms. If they are found to be not infected, then we can release them. But at the same time, it's very important to have them have people volunteer to have the tested, so that we could we can leave no one behind. I mean, it's very important to the isolate all these possible and the patients from the general public, so that the public will not have the too much fear. But at the same time, we know that the who's in condition and who will need the medical attention immediately, so that we could have the early treatment, which will make the likelihood to have the better results when they get treated.
Great, thank you. I guess this is probably for all three of you, but in this crisis with many jobs being eliminated or paused, have you seen an increase in any particular jobs or skills?
I guess I can start. In terms of increase in jobs and skills, is that we heard, at least we've been getting a lot of requests through not only the World Trade Center Los Angeles, but also the LA Economic Development Corporation, that online educational tools are much needed. To Thierry's point, a lot of the education systems are transporting directly into an online education system. So for those platforms that are providing that kind of technology and support system, we're seeing a demand for that increasing. Also, when it comes to international partnerships, a lot of these individuals who were previously going to international schools and such are now signing up for online services in the US, so that they can provide daily education, kind of English teaching or cultural education. So that aspect, we've seen some increase. Obviously, there's been a high demand for medical professionals coming out of retirement, and if they can volunteer their services, that's been also increasing. And lastly, what we're seeing is a lot of companies are now starting to retool their ability to manufacture products that are previously, for example, sports equipment, and now they're making face masks and medical equipment as well, and PPEs, person protective equipment, that are being distributed to medical institutions as well as governments.
Yes, I think it's, if I may jump in as well, it's a little bit early to say what will be the impact there. There's the immediate issues of finding healthcare workers and so on, obviously. But there'll be, I think, fundamental change in the economy, radical change, as you said, Stephen, retooling. Some companies will retool and will probably keep that business once we go out of the crisis, because they learn new things. I mean, for LA and Canada, there's even areas such as think about sports. Anything where you have gathering, so e-sport, I suppose, will be something of the future even more than it is today, as people will be less encouraged and less tempted to gather in large masses. So fundamental change to come in various aspects of the economy, the way we work, the way we conduct business, the way supply chain are being managed. A lot of remote solutions will need to be applied. COVID may be gone to some degree in a few months, but there'll probably be other unfortunate pandemic like that or resurgence of COVID. So I think those changes are here to last for a long time.
Yeah, well, I just want to add that I mean, it's difficult to project any other skills that has been developed through the COVID-19. But in terms of in case of Korea, it's certainly that our biotech industry has shown the more prospects in the future.
Yeah, there's AI as well, which already was very prominent, but even more today when it comes to predicting and mapping where disease may pop up, early signal as well where it could be, and not solely relying on hard data that are reported at a slow pace.
And with the tests, other than our test kits that we have shown that the mobile apps can be more helpful to our daily life, so that kind of industry can be seek for their more prosperous future.
Great. This would be for both of you as well, and maybe even for Stephen, you might know, but do you have a sense of how they are planning to continue testing as the economy opens up? Will it be random testing, testing everyone, and how often, or positives plus contacts tracking? And this would be for, I guess, all three of you.
Well, may I say that even if the COVID-19 kind of curbs down, that we still have to be vigilant about this kind of disease, because without symptoms or with very little symptoms, it can be very infectious. So I think we should be still keeping the testing all the possible people and try to separate them from the general public. And as time goes by, then these kind of the infected people will be getting less, and and if we can successfully block the spread out of the COVID-19 in the future, then we'll be in the better off side in the future.
Yes, we'll need to understand a bit better what this disease is all about. There's still a lot of unknown, but one thing that seems sensible is to have a wide testing of the population immunology, with antibodies test, and so that we know that historically when about 70% of the population is immune, either by vaccine or by being exposed to a disease. There's the so-called herd immunization that's happening, which really mitigates the propagation of a given disease. So that the test on the immunology will be, in the long term, will be as important as the other kind of test, let alone also for the economy. We need to know who can actually safely go and work on the production or the services or what's not, and that these people are indeed protected, because being positive in terms of immunology test may not mean that you won't fall sick. So that's something we need to figure out, and science is there. Overall, I think we should. It's a moment where we should give credit to science and base decision on science. We tend to at times forget about that very important thing, but this is critical, and it's certainly the approach that Canada is intended to pursue and has been pursued for a long time. So science-based advice, policy, design.
Thank you.
Okay. So, sorry, but just quickly, I think this is going to obviously change the way the world's going to operate in the future. We don't know exactly what the testing protocols will be, but we do know, just like any other global events in the past, after 9/11, there's been more secure, kind of travel restrictions, and can't bring liquid onto the plane after certain incidents. You can be sure that after this, this is unfortunately probably not going to be the only major global issues as the world is getting smaller and smaller and more connected. Pandemics will likely, be something that we have to be very vigilant about, to Thierry's point. And so I think we can expect that there are going to be more stringent protocols that will be in place, and hopefully through this lesson, we can learn how to actually partner with our global partners and respond to it a lot quicker, so that we don't get into a situation where you have individual countries that are operating separately, because we can see that the borders, they don't stop the virus from spreading, that we're one global community altogether.
Yeah, and as a follow-up to that, this would be for both of you. Again, Singapore, Hong Kong, and China have found an increase in COVID-19 when they increased international travel into their countries. What are your country's positions on opening travel?
Okay, let me go first. That in our country, in Korea, our position is that we are instead of imposing the curtain type of banning of the travel, we want to we want to have the people and the goods travel freely, with the caution of testing and screening, so that the people who with the virus can be detected in the early stage. At the same time, we don't block the international travel cross border. And at the same, in Korea, we are not just checking the people from the inbound travelers, but we are, for the outbound travelers, we certainly forbid people from if they have contacted before or if they are not safe, or whether they have the tested positive, of course they cannot go. But if they're contacted before, or if they have to be in a self quarantine, then within 14 days they are banned from the going outside. But without that, other than that, the essential part of the travel, international travel cross borders, that we are certainly to support, that has to be going on.
So in the case of Canada, I think the question is, in fact, there's two parts. One is what we do today and what we have been done today. And as I said, and it's the case for most countries, there's travel restriction for non-essential land and air, non-essential travel, and then self-quarantine is also a measure we ask people to adhere in Canada when Canadian comes back home. So that's the situation today. What will it be after that phase? We don't know. Again, science will inform what we should be doing. That's the general posture our governments have been stating. So relying on science, and then maybe also on technology, something I haven't really mentioned, but I think there's great potential also. There'll be a push to develop technological application that will predict and adapt the impact of the disease on population and where from it can, thanks to AI among other things. And that will be a key tool also to live with that disease in the long term.
Great, thank you. This will be our final question, but we'd like to hear from both of you. It says, thank you for your eloquent updates on your individual country's efforts. Could you comment on what role your government expects or wants from the Trump administration in providing international leadership?
Well,
okay, go ahead. Go ahead.
As I mentioned before, that we need to come together as a world, and once the UN Secretary General mentioned that that we are only as strong as the weakest health system. That means we have to leave no country behind. We have to no country will be completely safe until the whole world is recovers. So I think it's very important to assist our international partners, among our international partners, that we share best practices, lessons learned, and data and supplies, and we have to cooperate in terms of the economic measures to boost up the global economy, and at the same time, we need to help the less developed countries, or the countries with the less developed the health system, so that we can gather our full power of the whole countries in the world, so to eradicate the COVID-19 with the global cooperation.
Yes, so it's of course U.S. policy will be established by the U.S. and obviously the largest economy in the world, the most influential economy, the most influential country, has a huge power of conveyance and a huge influence on that crisis and many other multilateral issues. So our wish as Canada, Canada has very proactively and consistently have a policy to promote multilateral approach to global problems, an international order based on the rule of law. This is really our motto, the way we see how to solve these global issues. It's true for health pandemic, it's true for the economy, it's true for energy, it's true for climate change, it's true for a myriad of issues which we believe are better solved globally based on rules and resisting the temptation of solely national approach and coordinating national approach, which are costly and counterproductive. I think the COVID-19 pandemic is a test for our multilateral system. There are pressing calls, we all heard them, for collective action. The WHO is at the center of it, obviously. But we also see a lot of countries issuing global cooperation in favor of national focused response. We have to deal with the urgency, so we understand that. But very, very quickly, we need to recognize the importance for concerted effort on monetary policy, fiscal policy. Health is the most immediate problem. The positive sign that I see, though, and I think I already mentioned it, is that the scientific community, which has been accustomed to seamlessly work globally and share data and so on, works very well. So I'm very confident that in terms of solving the health issue and the science behind it, a lot of information is being traded, expertise and method of treatment will be shared quickly. So this is a very, very good thing. But where we see some shortfall is indeed at the outset of that current crisis. We should avoid a repetition of it, whereby the WHO hasn't been able to really collect all the data that was needed to really understand the scope of the problem and nip it in the bud, perhaps. So hopefully we learn a lot from that, and I think the US, as Canada, and Korea most likely have a big role to play in that endeavor.
Wonderful. Well, that concludes our questions. So Stephen, I'll turn it back over to you.
Great. Well, thank you so much again. I want to thank Commissioner Weissenburger and Consul Cool for joining us today. I think the lesson I took away from this conversation is the global connectedness between our various regions. And in times of crisis, I think it's even more important for us to establish these kind of a relationship, whether from a national or international level, and specifically for Los Angeles on a subnational level. I want to thank you for your work that you're doing right now and all the years before this as well. And we're looking forward to working very closely with each and every one of you during the recovery period. I think we need to depend on each other even more as we're looking in the future and how we can all recover together as a globe. So thank you so much. I'm going to turn it back to Kim, and thank you, Kim, and World Affairs Council for hosting this fantastic event. Thank you, Kim.